Welcome to the Living Medicine Podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show. Hey everyone, this is the second in a series of videos that we are starting interviewing actual clients about their experience with ketamine-assisted psychotherapy. If you haven't heard the first of these series, please check that one out. Our first one was with a client with complex trauma and talking about ketamine's usefulness for uncovering repressed trauma, as well as working with somatic interventions. So please check that one out. Today's client is talking about ketamine-assisted psychotherapy for an acute index trauma. This particular client was hospitalized with a severe and sudden medical illness and almost died, was in the ICU, unconscious in a coma for quite a while, with extremely distressing symptoms before and after, and also extended medical delirium, meaning that her ability to perceive what was happening in and around her was distorted in very frightening ways. And she came to me for a series of ketamine-assisted psychotherapy treatments, specifically to treat this index trauma. So this is a slightly different type of trauma treatment than the one we discussed in our last interview series, and is also a good example of spontaneous parts work when treating trauma on ketamine. So without further ado, and with much gratitude to this client for being willing to participate, let's get her on. Oh, I hear you. Yay.
Yay, that's good. That's a product.
Oh, look at that. We mastered a new technology.
Right. I had to go through settings and then push a bunch of, it was a little complicated. But
okay. Well, thank you for doing it. I super appreciate it. Before we do anything formal, or just chatting for a bit so I can explain what we're doing and also just make sure that I ask you all the things about your comfort level with what we're doing. So one, thank you.
You're welcome.
Two is I've been doing a series of these, and the goal is actually kind of to let other people hear from people who've done it before, because it would have been nice probably for you to have had people to talk to about this who had done it before. And that includes the hard parts, good parts, whatever, kind of like advice you would give other people that are thinking about this. And we just informally kind of chat about it. When we will blur your face.
Okay.
And then if you say anything identifying, like if I accidentally use your name, or if you say something that is too personally identifying, we can take that out afterwards.
Okay.
Some people have even asked if we would change their voices. We can also do that. Most people don't ask for that.
Okay. That's okay.
You're okay with your voice sounding like your voice?
I'm okay with the voice, yeah.
Okay. And then there's not really a lot of rules about what we talk about. So before, I mean, are there things that you are curious to talk about or you think would be important for people to hear?
I thought I had my notebook from the ketamine. I thought I had it with me. It was not with me. So I just had to go through dresser drawers and stuff to find it. So I haven't had a chance to, I was like, I'll review it and I'll be on top of things. I have it with me now, but I haven't been able to find what I was looking for first. I was like, I'm going to do a good job. I'm going to be prepared.
I'm impressed. That was a lot of foresight. Well, we can just go on memory even, because there's no real rules about these conversations. But it's cool to know that you still have those notes, even if you ever want them in the future.
Exactly. Yeah.
Okay. So what we're going to do is just kind of talk through your experience. In your words, why or how did you end up doing ketamine-assisted psychotherapy in the first place?
So I was had a major medical trauma and had been hospitalized and had been delirious and was told that I'd even been in a coma. And there was this huge chunk of time that I didn't remember. But at the same time, I was getting really triggered and having flooding and having memories coming back. And it was very overwhelming and sort of unable to function with it. So I started looking into trauma therapies, and possibly looking into EMDR, things like that. And then it was brought up that ketamine could be used for trauma therapy. And so decided to go ahead and try ketamine. Mainly, I was like, I need to take action. I need to do something because this is becoming unbearable. And so I was like, either this will work and be very helpful, or it won't work and I will find something else that will work. But at least it was taking a step and taking action and doing something, as opposed to just being overwhelmed and felt, instead of everything happening to me, I could actually make a step forward.
Yeah, I remember that. I remember you saying something like, I feel like now is the time. Like,
Yeah.
whatever it is, I need to do something now and felt
Yeah.
ready. Yeah.
Yeah.
What did you have any expectations or imaginings of what it was going to be like? And if so, was it like that? What was it like?
Yeah. So it was doing guided or supported sessions. And so what it was is going into the office, and it had like a combo medical team. And then my psychiatrist who was doing therapy with me was there. And so would get the IV hooked up and had a blindfold and got like to lay back in a chair, and they had a nice heavy blanket, and it was really posh. And then the medicine would start, and it was kind of like sinking back into myself, or going down this deeper spot. Like it was like going down into like a canyon. But then going through, we had talked in advance about some of the parts of myself that were affected, or that had like were that were activated, and were trying to process experiences. And so able to like go on this journey, and it did feel very much like a journey with these parts of myself, or encountering different things that like symbolized the trauma itself, or sometimes it was just very pleasant. Sometimes it was just scrolling imagery, or like, yeah, sometimes it was like kind of fractally, or kind of being in this deeper space of darkness, but it was like, it was a textured darkness. I don't really know how to explain. A lot of it doesn't translate literally.
That's true. You're doing great considering this is a really hard thing to put into words.
Yeah.
A lot of what you just said is interesting. This thing about falling back into a canyon, was that a consistent thing, or was that the first time? Or I'm always
That,
interested in how people describe the kind of onset of
yeah,
the
that was
altered state.
pretty, that was pretty much almost every session. It was just like sinking into this experience as stuff began. Can, can I say your name? Would you
You can say
rather I
anything you want. No, no, there's no rules on these for sure.
Okay. So as I was going through, I was talking, which the first time I did it, I didn't realize I was like not sure exactly what I was supposed to do, and if I was supposed to be talking and describing things, or if I was just supposed to be having the experience. But when I was articulating things, you, Signy, would be repeating things back to me, which helped to clarify some of the experiences I was having, or helped things resonate.
Can you say
But
more about that? That's kind of interesting. Like, how does having your words echoed back to you, what was your experience of that? I'm curious.
so it was kind of put things not necessarily on a loop, but able to like go and stay with a thought longer,
Mm-hmm.
uh, acknowledging that this could be significant, or this was opening something further to kind of keep on track, I guess. I do feel like the sessions were kind of guided, but so much so they were supported,
Yes.
definitely. You definitely played an active role in it.
Yeah.
I've talked to some people that have done ketamine treatments at other places, and they were just like given a dose and left in a room with like a nature documentary on and low lights and stuff. Um,
Well, I'll stop
and,
you and say you're describing actually the difference between ketamine treatment and what we call ketamine-assisted psychotherapy, which is a
okay.
therapy session facilitated, and enhanced with the person being on ketamine. And that is the difference. Is yes, there was a more active role of myself as the therapist, and a lot of what we are doing is just tracking along with you and mirroring things back, which is exactly what you said. But it's interesting to hear you say that that sort of helped land you in it more or highlight it more, because
Mhm.
often what I'm doing there is just repeating your exact words back, right?
Yeah.
So it's stuff that's already happening for you.
Mhm.
But there's something about knowing that the other person is witnessing it or dialoguing with it that helps you almost notice it more.
Mhm.
That is a hard
Definitely.
thing to put words to.
Yeah. Words are definitely complicated on ketamine.
Yeah. Yeah, it's a
Right.
non-ordinary experience. So it is hard to, it's like we're talking about a dream state or something for sure.
Mhm.
It's hard to name. You also mentioned a minute ago when you were describing your journey, I think you called it, this idea of parts. And this happens a lot with people on ketamine. Like, what was your experience of that?
So we had identified like a younger self or a hypervigilant self or parts of myself that have been very, very heavily impacted and traumatized by what everything had happened. And so being able to acknowledge them directly, having that experience of meeting and working with these parts. And sometimes it was like literally could see like a younger version of myself or could tell that was humanized or there was like a visual connection there, which was really intense. I think um, I think one of the biggest takeaways I had from the first session was that I felt safe. Like I could interact with these parts and acknowledge that right now in this moment, we are safe. Um, and that was huge. I had not felt, even when I was like logically knew that this was not happening, this is over now. This is, but still, that things had still felt in the body and in the mind that things were still, I was still in danger. This was still happening or was going to happen again or was, being
Hmm.
flooded, and being able to have a moment where I did feel like that I was safe, that and could acknowledge that to my younger selves or things like that, that we are safe right now. We do not have to be panicking. We do not have to be overwhelmed or upset or, you know, we do not need to be actively traumatized or actively in the trauma right now because right now is okay.
That's a beautiful description. I remember that too. My memory is that you had not done parts work
Mm-hmm.
in regular therapy. So this idea of having parts kind of came up on ketamine.
Mm-hmm. Very much
And
so.
and it's not uncommon at all. And it's something that kind of surprises people to know that they have parts, younger parts that not only are scared, but also developmentally are too young to understand everything that our adult self understands. And so
Mhm.
there's this mismatch. And I remember you saying something along these lines in the very beginning. Often when we're traumatized, there's this mismatch because consciously we know that we're not in danger anymore, but
Mhm.
yet our nervous system is basically still freaking out on
Yeah.
us because these younger parts don't know that. You said something like that a minute ago. Like there was a parts of you that don't actually know that you're safe. And so
Mhm.
something about actually being able to communicate that to the younger parts sounds like you're saying that created a shift that you remember.
Mhm.
I think that that was a beautiful description of that. Also said a few minutes ago that you experienced these parts as real. Like
Mhm.
it wasn't just an idea. It was kind
Mhm.
of like you met them on some
Yeah.
way.
So
So is that a sense or was that you said something about visual? Can you say a little more about what you actually experienced? I'm understanding that it's hard to put into words.
it's definitely hard to put into
Yeah.
words. I think having done some prep work around that did help to understand what I was experiencing, or had like, I wish I had reviewed my notes so I knew exactly
Well, I'm
what.
gonna, because it is super interesting, and I know we're just talking about it broadly.
Mhm.
But I'll say, as your therapist for the ketamine part of your treatment, what I saw, and I see this with other people too, is that unlike in sort of ordinary awareness, like the way we're talking right now,
Mhm.
when you were on the ketamine,
Mhm.
it's almost like you had the ability to speak for those parts. So
Yeah.
I would say to you, like, what is she thinking or feeling? And you would know right away. Or you would like ask her and then tell me. It was almost like you were translating or between me and them or between you and them. And it was clear that there was almost like a way to think of this as a metaphor was like more people in the room and
Mhm.
we were all in a dialogue with each other.
And there was definitely some of it was like actually seeing a child as opposed to, and like having, a direct conversation with that child. Some of it was a little more amorphous than that, but being able to acknowledge and care for that child,
Mhm.
and being able to communicate, ask questions, and have answers, and also give the child a chance to inquire and ask for comfort, or ask for clarity on what is happening, what is going on, why is this happening,
Yeah.
what are they, what's making them afraid, what do they need for comfort, sort of things.
Yeah, I love that. You mentioned an opportunity to, ask questions and get answers. So this is kind of an intriguing one. So where were the answers coming from?
um, a lot. I mean, sometimes it was just a verbal, like, what do you want? I want this sort of thing.
Like, so
But
the part
often,
of speaking directly. Okay.
but I think more often, or just often, it was a feeling of, being able to directly ask the question and then have the feeling of knowing the answer,
Yeah.
uh, and having that resonate within, as opposed to being direct conversation. But that was where it was helpful to have you with me, because you could guide me in that sense of, what does she need, what is going on, sort of questions like that, where you weren't, it's not like you were planting things or anything like that, but helping to interact with these parts.
Yeah. So my word for that, which I think you've described in a really lovely way, is sort of prompting you to keep checking in with these parts of yourself and see what's
Mm-hmm.
already there and
Mm-hmm.
spend a little bit more time noticing or checking or listening. And um, you said something a minute ago that I wanted to highlight. One of the reasons I asked the question, like, where were these answers coming from, is because I want to make sure to dispel the perception that people may have that the answers come from me as the therapist.
Oh
Because
no.
but I kind of partly want to educate people to by sharing with you and them that like, and when I'm doing this kind of work, like with you, I didn't know what the answers were going to be either because I can't know because I'm not you.
Mhm.
So the answers are coming from you. And that's what I think is so fascinating about this kind of work, or one of the many things, because all these parts of us are us.
Yeah.
And so it's interesting as a therapist to do this work in a way because you're almost watching the client, which was you in this case, dialoguing with themselves and almost problem solving and finding out what the needs of the different parts of their own system are, and then providing those needs for themselves in their system, right? In this, and so I find it very compelling and to watch someone have that what looks like almost like an empowering experience of that the solution comes up kind of organically
Mhm.
from the person. So, and I never know what the solution will be because I have to wait and hear it from you. So that's so fascinating, right? I just like to put that out there. And there is a concept in this work called non-directive approach for the therapist. That means that I'm not supposed to feed you anything, like you said,
Mhm.
or tell you what's going on. I'm supposed to just prompt you to keep noticing more.
Yeah.
But at the same time, there is that prompting that you named. And I think in your sessions, the main two things I was doing over and over again were the mirroring, like you
Mhm.
said, which is mirroring your
Mhm.
own words back. And then this prompting, which is usually statements like notice, like see what else is there,
Mhm.
or check what else you can notice.
Mhm.
And then you would do that. You would check.
It was a theme. Yeah.
Other things that feel important to you to say, or that you just think were interesting, or things that were that you struggled with it, anything like that that we should talk about?
Um, well, I did have the one session that I struggled because with my trauma being medical based, I had a session where I was more aware of the IV being monitored. It like really zoomed in on being in a hospital, having things done to me, like being in
Yeah.
that medical scenario. So that was like triggering within it.
Yeah.
And being triggered while in the ketamine state was much more intense and harder to I was definitely supported, and it was a safe environment. I did not feel safe in that time.
Yeah. So just to reiterate that, because your trauma was medical trauma when you were hospitalized and hooked up to IVs and such.
Yeah.
Um, in this session, having the IV in your arm and being manipulated, like the IV itself,
Mhm.
uh, triggered a trauma flashback to that, that trauma moment in the hospital, or a kind of a layered series of moments, and you re-experience that in the moment.
Yeah, and I afterwards it was like I really I felt like I should have anticipated that because of the medical side of getting ketamine treatments is you do have an IV, you are being monitored.
Well, I
um,
don't think you should have had to anticipate that, just to be fair. But
I,
anyway,
I feel like I should have been like, oh, this might be a thing. um,
maybe we should have, but not. But so tell what was your experience of that, how that played out?
it was very helpful to have you there to kind of guide me through what we were noticing, but also to kind of help guide me through it and guide me out of it. It did resonate in a way that I was impacted.
Like shaken up, you mean, or by
Right
impacted?
now the heat just turned on. Can you still hear me? Or do I
Yes.
need to? Okay. Um, but it did resonate with me for the next day or two, definitely. And it was having that hangover from having like a very intense experience that just by having it happen in the supported environment, I was able to move through it at the time, but then it kind of came up and kind of rolled through for the next couple days, where it was like, and then there was this, and then it was okay, and then there was this, and then it was okay. So that was harder for me, and I do think, we did kind of talk through it, and and about what was needed to be supported, what needed to be cared for with this, and it was hard. That one particular session was hard for me, but it didn't deter me from continuing the treatment. For example, I just was more aware of that, and that was like our second or third session, and so I was still very on board to continue. But in the future sessions, we revisited those places, but had felt reinforced going into it, was able to interact with the parts that were triggered or scared or that were traumatized by what had happened and stuff, was able to interact with them and care for them in such a way that we could then move through that time again without without being triggered as much, without being overwhelmed, to be able to be more along the lines of, it's okay, this is happening, we are being cared for, both in the historical that was being revisited, but also we are safe in this environment, we are being cared for in this environment. And this is, again, being able to say, this is not happening again. And also that even while this was happening, we were being cared for. We did have a team helping us at the time, and that was,
I remember that.
Yeah, that was really powerful. Yeah, just being in that space where it felt much safer, where I could, explain to the younger selves what was going on, to be able to tell like the young one, no, we are okay. We were in the hospital. We are being taken care of. We are okay. You can come into the room. You can look around and ask questions, and know that this is safe.
And you
Kind of
that almost like a dialogue between the parts. This
very much a
dialogue.
Yeah, but that was one of the occasions with the ketamine where it was very concrete. This was my younger part who was humanized, who was a physical person to talk to talk with, and to talk down. And
that's super interesting to hear just from your perspective. That's what I witnessed as well, but it's totally different from the outside than, I'm sure what you experienced from the inside. There's a couple things that I'm curious. One, it's just a comment, which is it's a good reminder that not all ketamine experiences are pleasant, or that ketamine, you can go to some scary places. In that instance, we triggered a trauma with the IV, and then that became one of the things that we worked with, and that became a thing that was sort of an avenue into working with the whole trauma in a way, right? One of the avenues into it. But one of the things that I'm curious about is when a part is able to reassure a younger part or nurture a younger part, or whatever is called for. I see what from the outside, what looks like like a shift in the person's body, almost like a shift in anxiety level, like that. To me, it looks like someone goes from a kind of a tension or looking anxious to almost like like there seems to be some sort of shift. And I'm curious, and it's totally fine if you don't have words for that and or even remember anything like that, because sometimes what I'm seeing from the outside may be different from what you're experiencing. But Do you have any thoughts on that?
There was definitely the experience of being able to just exhale, and with that, like sinking deeper, or sinking, like I felt like it was hard to, I mean, symbolically it was hard to take a full breath, but during the ketamine treatments at different points was able to just exhale and kind of sink deeper into the ketamine experience, but also sink deeper into the feelings, specifically the feelings of being safe, or the feelings of being,
Mhm.
there's definitely feelings of being curious there, um, but being able to settle more into the experience and having that release of tension physically, it did feel like exhaling and melting into this other world landscape
Yeah,
thing.
maybe a more relaxed place because there was more sense of safety.
Yes, definitely. It's definitely.
Yeah, I think that
Yeah.
so much of your work was in that your journey with this work was about learning to feel safe or learning to communicate to the different parts that needed to
Mhm.
be helped to feel safe.
Yes.
And I know both of us got a little choked up at times. It's pretty emotional to watch that unfold for someone, and it's also very humbling. And I always feel honored just to witness those sorts of um, journeys that, for someone, because it's, I say this to everyone I interview because it's always true. Like this is intense and hard work to do.
Oh
And,
yeah.
and it's, and ketamine assisted psychotherapy or any kind of psychedelic assisted psychotherapy is not a situation where the client comes in and is given a psychedelic and is like, "Oh, I'm all better now." No, it means that it opens up a doorway to some really hard work
Mhm.
that the client then has to sort of step into, you in this example. And so just honoring that side of it, because it can be really powerful change work, and also it's work, and you have to go through a lot of discomfort sometimes too. So I'm just acknowledging that I witnessed you doing all of that also. Anything any advice you would give if you had a friend or someone asked you who wanted to do this? Things people should know or think about ahead of time. And if you don't, that's okay. But I'm always,
I think one of the things that really benefited me was going into it very open to, not saying to be uninformed, but going into it not having the expectations of this is exactly what's going to happen. That the idea of this journey and things are, because it's not, I'm assuming, having only had my own experience, but I'm assuming not everybody has the same experience with it. But also definitely having a partnership with your therapist for there, and having an understanding and an ongoing dialogue. Like I personally wouldn't immediately sit down for the first time with someone I didn't know. I felt that that was important, that we had a rapport, that there was trust there, that we were very fortunate to have a history working together,
yes.
uh, which
So
I know isn't.
we should say, though I had never been your therapist before, I've been your prescriber for many years. So
But
there
you
was,
were my scrapes, so
so
we
there's
we
something,
agreed with each other.
yes. So there, I think I like what you're saying because it is important that there is a pre-existing trust, because that's what helps create the safety.
Yeah.
Because these experiences can be very unnerving and very vulnerable. And there's a concept in the biz, so to speak, called set and setting that we that the providers talk about, which is the mindset that you're in, but also the actual like setting, the people you're with, and the environment you're in, and how that can have an impact for good, but also for ill.
Mhm.
If you, for example, don't feel quite safe with the person, it can really affect the experience.
Mhm.
So I do
I
think
think
that's
the vulnerability there is big. So having that level of trust is really important. Um, and then also in terms of the physical setting, you guys worked very hard to make sure it was very comfortable, very cared for from the moment coming in. the medical staff was wonderful. The accommodations in terms of the blanket or the eye mask or the
Posh
stuff.
stuff.
It was posh. It was so fancy. It was like a spa, There was like the relaxing music playing, and it was like, minimizing external senses so that could really embrace and focus on the internal experience.
Yeah. Yeah. That's the set and setting pieces. So I'm glad you shared it because I think it is helpful when people are picking a clinic or picking a place to go to just think about how the environment will affect them or their relationship with the provider. And just know that all of those, I'm sort of saying this for the audience, but knowing that all those things are important so that, because like you just said it and I said, it's vulnerable work.
Mhm.
And it takes courage to do it.
I'm very glad that I went through the experience, and it was made such a huge difference coming through the sessions, doing the work. I have had much, much fewer incidences of panic attacks or flooding or being triggered. Still, it's not like 100% cure or anything like that. I'm still continuing to do the work, but it really, I feel, dealt with the physiology of the trauma or quicker, more efficiently than some other forms of talk therapy. Might take longer to get to those spaces. And I had a very positive experience. And I make a point when I'm talking about it. It's like, I had this experience. This is how it was set up. This is who my provider was. You may not have the same experience depending on where you go, how things are set up, or how you do it.
You said that earlier, that everyone's experience is unique in your opinion, and I think you're right about that. And I also, I thought what you said about not having expectations was perfect advice. Because we often say that to people ourselves, like anything, it could go any direction, anything can happen. Everybody's different. Every session can be different. And it's important not to go in with some idea that this is how it's going to play out, because that can create some frustration when that's not what's happening. And it also can stop you from noticing what might be happening. So considering that you're relatively new to this world, that was some pretty good professional advice there. I just want to say that it takes some courage to do what you did. You called it a journey, but it's a hard journey to do, to walk through one's trauma. So, in my opinion, you should you get the bulk of the credit for that because you have to show up for that. So, just putting that out there. It's easy for me to be sitting there witnessing it. You have to show up and feel it, right?
Yeah.
Naming that. So it's maybe just
this is. I'm really glad that I did it.
Well, I want to thank you for doing this. I appreciate those of you guys who are coming on and doing these interviews. It's a huge gift to just kind of spread the word and help other people feel comfortable doing it. And also not comfortable, but also fully informed. Like knowing that it's, like we said, it's not necessarily like sprinkle fairy dust and everything's fixed. It's challenging work. So it's helpful to spread that out there and just get more accurate information and hear it from kind of a firsthand account. So I really appreciate, you guys don't get compensated for this and you give up your time and your energy to do this. And so I just want to thank you on behalf of me and everybody else that may hear this in the future.
You're welcome.
What?
I said you're welcome.
Oh, good. So thank you very much again for doing this. Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.